today's Chats About Children, we have an incredible opportunity to hear from individuals who have much knowledge and expertise about child care funding, licensure history, about health and safety measures that child care centers are taking, particularly during COVID. So this morning, we're delighted to have Ms. Andrea Sanders, Deputy Director and Chief Legal Counsel of the Mississippi Department of Human Services, Dr. Chad Allgood, who is Division Director of Early Childhood and Development, and also State Administrator for the Child Care Development Fund. And we'll be joined later in the chat by Dr. Thomas Dobbs, State Health Officer. So we recognize that each of you, and you were so incredibly busy anyway, even before COVID. And we know that your leadership within the agencies play a pivotal role in getting services to children all across the state. It's also our understanding that each agency is being guided in a large part by the CDC guidelines regarding COVID and child care. But before we get started about the COVID, Andrea, would you tell us about sort of the overall big picture about the role that DHS has in child care in Mississippi? So I'm not sure that the general public necessarily thinks about the involvement with child care in DHS, but it plays a critical role. So would you tell us more about that?
Yes, thank you, Linda. Good morning, and thank you, first of all, to the Children's Foundation for hosting this opportunity to talk to all of you. Child care is one of those programs here at DHS that is it's become very personal to me, and it's very dear to my heart. And I think the reason is that it's a program that works on many levels. Folks in Mississippi cannot go back to work or go to work to start with or be trained to work if they don't have care for their small children. And we know that there's a shortage of child care in Mississippi and that child care is expensive. So our program is funded through the Child Care Development Fund block grant. And fortunately, Congress saw fit 2 years ago to significantly increase the funding that was dedicated to that program. So Mississippi saw its budget almost double. We went from somewhere around a $50 million program to close to a $100 million program. That is still not enough to meet the need in Mississippi, but it allows us to subsidize for parents in low-income families the cost of child care. And the way that works, Linda, sometimes it confuses people that we somehow run child care facilities. And that's not exactly the case. What we do is we stand in the place of the parent who is eligible for child care, and we pay child care providers directly on behalf of that parent. So it's a little more like maybe Medicaid, like third-party reimbursement. We determine if parents are eligible for the program, and then we reimburse eligible child care providers for the care they deliver. We also spend some of that money by federal mandate and because it's the right thing to do to help incentivize progress and quality in child care delivery. We think that there's really no better way to make an impact on our economy as a state and on the well-being of children and families than to start very early. We know that early investments in children pay the biggest dividends. And so part of the money that we spend is investing in a framework that will help incentivize and provide the resources for child care providers to improve the quality of care that they deliver to young children.
Thank you, Andrea. That's really informative. So I'm really hearing this as more of a workforce, helping the workforce of today for parents who need assistance so that they can be in workforce or training, and then really helping the workforce of tomorrow by providing quality care, early education for young children in Mississippi. So thank you for that. That really is helpful to set the stage. So now, Chad, I know that you will drop it over to you. I know that you also bring years of experience from childcare licensure when you were in the Mississippi State Department of Health. And so you know a lot about the health and safety standards. But from where you sit now within the Mississippi Department of Human Services, what are your like day-to-day activities and how is COVID-19 influencing this?
So again, good morning, and thank you so much for giving us the opportunity to join you all this morning to talk a little bit more about what we do with early childhood and child care programs in the state. You are right, I spent 3 years with child care licensure, and being able to bring that knowledge over to this position has been very helpful, especially amid COVID-19. My daily, our daily activities with the division, we of course are, processing subsidy certificates, as Andrea said, for families that qualify for the program to subsidize their child care costs. But, really what I found is our day-to-day activities are all about supporting the families that are on the program, the families that need assistance, but then also the child care providers. We spend a lot of our time, we have really made a point to open the lines of communication. And we spend a great deal of time listening to what needs are and responding to those needs. We really want to focus on if there's a family that has a need pertaining to childcare or early childhood, or if there's a child care provider, that wants to serve families in that capacity, we're here to help them with that. And we're continuing to do that, but COVID has added an extra element of, for lack of a better word, complication, or it's made things a little more complicated. But I will say that we have put several programs in place that were designed to really help these families and to help these child care providers. We often say child care is the backbone of the workforce. Without quality child care, families can't go to work, parents can't go to work, grandparents, aunts, uncles, whoever, that have children in their households, they can't work. And so our division is really committed to helping those child care providers. And with the COVID situation, we're really focused on not only keeping the child care industry going, but also helping child care providers provide the safest and healthiest possible care and education for these children. We know that parents that are having to go back to work, or that have been working since the beginning, it's a concern leaving their child, in a child care facility, knowing that there is this virus that's out there, and this virus is a very serious thing. So being able to help these child care providers create this environment, and I'll talk more about the Childcare, our intervention plan in a few moments.
Yeah, so thanks for that. As you mentioned, you were at the health department before, and Andrea, I know we've talked about this as well, how important it is anyway, but particularly in a time such as this pandemic, for agencies and people to be working together, because we have the ultimate goal of what are better outcomes for children. So by helping parents, obviously we help children. By helping child care directors support them, we help children. So how is Department of Human Services coordinating efforts with the Mississippi State Department of Health?
So I mentioned Childcare, and forgive me, we're really famous for using lots of acronyms and lots of letters. So what Childcare stands for, and that's CCAIR, it stands for Child Care Crisis Assistance and Isolation Response. I know that's a mouthful, but the program was actually created directly in response to COVID-19. And it initially began as a program to set up temporary pop-up child care centers. But it has since morphed into a support program for licensed and registered child care providers. And when I say licensed or registered, they are licensed or registered through the Mississippi State Department of Health. No one is better suited to care for children than these licensed and registered providers. And acknowledging that, we wanted to create a plan that would help support them as they're continuing to serve families. So I'm going to take just a moment to kind of show you our support programs. As Andrea mentioned, we were fortunate in that we received more funding. We were even more fortunate in that we received approximately $47 million in funding from the CARES Act. And I'll kind of just show you a brief description of how we've allocated the funding for that. So in the blue, you see the $8.2 million, which was approximately 17% of that funding. We're using that those emergency certificates to serve those in the workforce that were considered essential. So it began with your healthcare field, and these were the people that were not able to quarantine at home because they were needed to help fight the virus. And since then, we've expanded that population to include anyone that is interacting with the public. This includes people that work in the food industry, so people that work at grocery stores, at restaurants, first responders, but then also the police force, those that work in that do any kind of like public clerks that work in government offices where they're interacting with the public. So we've expanded that. These emergency certificates, they allow these individuals to receive help to subsidize the cost of childcare, and we do not take into account their income level. We do look at what their job duties are comprised of and make that decision based on that.
So this is a short-term initiative. These are short-term certificates. They're 3 months in duration, and the intent was to fill a need immediately and also to infuse money into child care centers when some children were staying home. When parents who could stay home did stay home, this allowed us to shift funding in a way that both supported child care centers who were remaining open and also supported the workforce, the persons who might not normally be eligible for a child care certificate in this program. We had to do this under a waiver through the Office of Child Care, and so for that reason, they are short-term, time-limited certificates. The intent of this program, long-term, is to support low-income working families, but recognizing the odd circumstance that we're in, that we really needed to support a different workforce for a period of time, we do have these time-limited certificates, and it has successfully done both things. It has really shored up child care centers when their normal population wasn't attending. So back to the
right. So some of the other initiatives that we've put in place, we've also we have increased our rates that we are paying for these certificates. We've increased the rate of it's about approximately 25%, and we've allocated $13.9 million for that. And those are, we did that for a couple of reasons. Again, to support that workforce, but also to ensure that child care programs have a stream of income. And we are basing all of our certificates on enrollment, not attendance, which means even these child care programs that are serving families, maybe the families were quarantining at home, which again, a very responsible reaction to the pandemic. This way, even if the children were not attending, these child care programs were still getting their income. They were still getting a stream of income. We wanted to make sure that these child care programs, we wanted to keep them going. we wanted to do everything that we could to make sure that these child care programs, weren't going to have to shut down because of lack of income.
Yes, and so those are great points, and there's no question, just look at the data on how this has worked, because when we think back to March, when so many of childcare and other businesses were certainly shuttered across the state, and now I know you have coming up, we'll talk a little bit later about the numbers of childcare centers that are now open, but maybe we can also talk a little about the PPE and how you've been able to help shore up some of those and meet some of those expenses?
Sure. So we did back in May, we were able to secure some PPE, personal protection equipment, which included masks, gloves, then also some cleaning, some bleach, some cleaning solution, hand sanitizer. And we were able to secure those, and we sent those out to all the child care centers in the 12 hardest hit counties, those that had the highest cases of COVID-19 at the time. And right now we're working on allocating more funding to get more PPE out to child care providers. Our plan is to do that through, it's a shared services platform, and every state has this for child care programs, and it establishes buying power through, what happens is child care programs typically buy membership into the shared services, but we were fortunate in that we had a philanthropic entity that actually purchased memberships for the entire state. And so we're leveraging with that and working through that shared services platform to, like I said, allocate some funding so that child care providers can get those supplies that they need.
I'm glad you mentioned that, because I think I read within the last few days there's a deadline coming up for child care providers to take a look at that with some of the Mississippi Development Authority dollars.
Right, that's a different program.
That's a separate one, okay.
So we are trying to coordinate with the other entities that are providing PPE, Linda, and that makes a really good point. MDA does have some funding that's being allocated through MELA, the Mississippi
Early Learning
Alliance. And so rather than trying to just blast everybody from all different angles with PPE, which they don't have room to store all at one time, our funding actually has a longer lifespan than that year's funding that went to the legislature. We have 2 years to obligate our funding, and so what we've done is coordinate with Dr. Grace, who's really sort of spearheading that program, and we've set it up so that the system delivery is the same. It will be the same expedited process for child care providers once they get registered, but we're going to allow them to access her funding first, so that we can maximize the funding that's around for child care providers for the longest period of time. We anticipate our funding probably won't have to kick in until December or January, once hers is either all spent or, let's hope none of it has to be sent back to the federal government. But yes, I believe she does have a deadline coming up very shortly, and she's merely requiring that anyone who's interested in receiving the PPE who is a provider register on a fairly simple form.
And they're providing training on how to use that platform.
Right. Okay, so I just wanted to clarify that for our listeners because of the PPE with DHS, and it's so wonderful to know that that's coordinated and that yours will be able to last longer once this upfront PPE is available for childcare. So let's talk about some numbers. I think, Chad, when we take a look, there they are. You want to go through that? It's around 1,500 licensed childcare centers.
That's correct. Day to day, we're looking at the landscape of childcare in the state. And we're watching these numbers to see how many programs are opening up. Back when COVID first hit, we actually, the number of open childcare centers was around 500. And thankfully, we have seen those numbers steadily increase. And as of this week, we finally reached that 1,000 level number. So this is just kind of the current landscape we've got right now. We've got a little over 1,000 child care centers that are open and caring for children. Of those that are open, 729 accept the subsidy vouchers through our program. So parents have these child care centers they can utilize if they are wanting to, if they need assistance with child care. We still have about 457 child care centers that are closed. Of those that are closed, 171 accept subsidy. The last two numbers that I want to talk about go into the next thing that I want to talk about, which is our C-Care plan. We rolled out through partnership with the Mississippi Early Childhood Inclusion Center, and that is a center that is part of the University of Southern Mississippi. Typically, they focus on children that have special needs and early inclusion, but the folks that work there have a wealth of knowledge in sound child development and early childhood education. And so they actually created a training for us that I'll talk about in just a moment, specifically in response again to COVID and helping child care programs be better equipped to deal with the issues with the virus. I'm happy to say that we have over 900 child care providers that have taken advantage of that program, that have taken that training. And are putting these practices in place. It is fantastic. We've been very pleased with the response to that. And that 913, those are licensed or registered child care providers. And again, as I mentioned, there's no one better qualified to care for children than these providers. And then with our C-Care plan, we also have established 13 temporary sites. These sites will not, we're watching this situation with COVID very closely, and at some point we will, we will be closing down these sites. But these temporary sites were set up in a way to support areas that might not have licensed or registered child care available. So I want to talk a little bit about C-Care, and I've got some information about this program.
Sure.
This week, we are sending out, what you see here is the logo for the C-Care program. And we're sending out window clings to child care providers. We want parents and families to look for this logo at their child care center. Because what this means is, if this child care program is displaying this logo, it means that they have taken the C-Care training and they are putting these additional practices in place that the training emphasizes. And what this training emphasizes is the importance of keeping children healthy and safe in childcare, specifically when dealing with this virus. This is not like a hurricane or other natural disaster in that this is a crisis for sure, but it's a very specific crisis with very specific response that is needed. It also emphasizes the importance of doing screening of both children, staff members, anyone that may be entering the child care facility, and then also the extra cleaning and disinfecting that is important. But it doesn't just focus on cleaning and disinfecting and screening. It also goes into activities that child care programs can do with the children to make staying safe fun. Children are feeling the effects of this virus just like adults are. They're feeling the stress of that, and it's very important that we help them. If children are wearing masks, we don't want that to be scary for them. We want to make it. We want to teach them. Being safe is cool. Being safe can be fun. And then, of course, other activities that teach children about the value of social distancing and, not not sticking their finger in their friend's ear or, you know, in their friend's mouth.
And doing what
Like,
children do. So this
okay.
is wonderful. And I guess I'll date myself here, but it's almost like a good housekeeping seal of approval, if you will.
Yes.
If you see that
Chad doesn't know
logo,
what that is, but I do.
so if you see that logo and it's like, okay, well, like on in foundations, it's the God Star. People are transparent with what they're doing. They've been trained, etc. So I am just so encouraged to hear this and to learn more about it, because not only do we know that young children, and they may not be able to express their feelings of being anxious, but what they've been hearing and sensing from their environment, etc., but also within the child care centers themselves. I spoke with a child care director recently when I asked her how she was doing, and she says, I just have knots in my stomach. And she says, I'm just so fearful that it's something that omission or commission, certainly more omission that they would never be aware of, that a child might have COVID or a staff member. So I just think that the more that people can do and have this amazing training, and the fact that so many have participated in it, that's just tremendous. So the training is will be ongoing. Did I understand that correctly?
Yes, that's correct. And we've made this training available to a multitude of organizations that do other professional development training, and they're offering this free of charge to child care providers.
So will this help with the continuing education
Yes.
units that child care providers are required to have?
Yes, this training is also that they can receive what we call contact hours, contact credit for the training.
Yeah.
Yes.
We also are paying that higher rate based on completion of the training. So we're using our funding to incentivize child care providers to take the time to use the training. But frankly, there was so much fear, and still is, as you indicated from the provider you talked to, Linda. I heard from numerous child care providers through email and text about their fear, of keeping their doors open, their fear of closing their doors. And, it is a very real, ongoing fear. And, our message to them has been, there is no right answer. We're right here with you. But we recognized early that they needed a framework that gave them guidance. It is not, it's not a complete and total solution, but I think having that guidance so they're not trying to guess on their own what best practices are.
Yeah.
And then we've just, this ongoing communication, we've begun every 2 week having a Zoom call with all providers that want to get on and ask questions and have, access to our staff and decision making. And I really think it's made a world of difference. Our tone and message consistently has been, we're in this fight with you, and our goal is to support you in keeping, you mentioned the two workforce sort of prongs of this program. One is to help parents go to work and stay at work, and the other is to support the workforce of the child care sector. There are small businesses, and they are running on a very thin margin most of the time. And if we lose that workforce, restarting this economy is going to be next to impossible. So that is why all of our activities have been targeted to keep a steady stream of child care providers open. And then, we are continuing to consider policy mechanisms to start to build and incentivize folks to join the system, maybe that have never considered doing so in the past.
That is so tremendous. And I would just want to thank you, each of you, for your leadership and the whole team there at the Department of Human Services that is really very intentional about being more transparent, keeping the communication lines open, having this as a team going forward. That is just really important now, I think, more than ever. Dr. Dobbs, thank you so much for joining us. We've been talking with Chad and Andrea about the importance of childcare on so many levels. And we know that parents need to work, and it's particularly challenging when it comes to childcare. But the great news today is that over 1,000 childcare centers in Mississippi have reopened their doors, which is quite a contrast to what it was back in March of this year. That means about 450 are still closed. But so we've been talking about some of the funding, some of the training, the great collaboration between your department, the Mississippi State Department of Health, and also Mississippi Department of Human Services. So for Dr. Dobbs, for parents and grandparents listening in, what are some examples of what the health department is doing to assure the general health and safety measures are being taken to mitigate the spread of COVID-19?
Yeah, no, thank you, Linda, and thanks for having me.
Sure.
You know, there are a whole host of things that we've been doing to work with child care centers to make sure that they can operate as safely as possible. What we have learned throughout the course of this pandemic is there are ways to do things more safely. And fortunately, we've had only a very small number of outbreaks. We haven't had many centers that have had to really sort of shut down for much of a period of time. Certainly, we've had cases be introduced, but those simple measures that we know are very effective, just a little bit of space, a mask, hand hygiene, and then people staying home when they're sick make a huge difference. And we have a very detailed set of guidelines that are available to help child care centers make sure that they can follow those very simple things that help keep us safe. We know that there are sort of tricky situations that arise when you have a case, or maybe you have more than one case, or maybe you have a family member of one of your folks one of your kids who's got it. And so not only do we have pretty detailed guidance that we provide, but we're also available to kind of walk through different scenarios. And I just got off the phone with Tabitha Bynum, who's our director of childcare licensure right now. And
Yes.
We haven't had a lot of complaints actually, but we do have a lot of questions about nuanced situations. So everyone should know that we're here to help and help work through either whether it seems like a simple question or if it seems complicated. We want to be there to help make sure that we can keep the kids safe.
Thank you for that. And yes, Tabitha has been really great to supply information as well. So you mentioned about face coverings or masks. Here's a question that came in from the public. How does the age of child determine whether children are wearing face coverings when they're in childcare? Obviously, for infants and for very young children, that's a safety hazard in itself with having a face mask. But how do you determine the age of a child? I suppose this is pretty much with CDC guidelines, et cetera.
Yeah, so CDC guidelines do state that, you know, under two years of age and younger, it's not appropriate for them to wear a mask, right? So, which makes sense, not really able to do it for themselves. And so a lot of it has to do with the dexterity of the kid. If they can, you know, take it off and put it on themselves, it's almost a pretty good mechanism to understand when it's appropriate. Within the governor's executive orders, it's kids under 6 years of age that are not required to do it according to the executive order, but certainly it's recommended because we know it is a useful mechanism to keep the germs contained within us, you know, within that little space, and it keeps it from spreading more into the environment. But the other thing that had come up before is should kids wear a mask when they're napping? No. If a child is asleep or napping, you know, there would be a potential hazard, and so please do not have kids or adults, even for that matter, wear a mask when sleeping.
Okay. And so I know in the last several weeks or beyond, time just sort of loses me these days, but there has been offering of testing, COVID-19 testing for teachers as they have reopened schools or before, et cetera. Could you tell us about how that is working with childcare providers?
Yeah, so, you know, I believe it was last week, well, there's a couple things to talk about. The first thing is, if you have symptoms or if you think you've been exposed, you don't even have to prove you've been exposed, but if you think you've been exposed, everybody can get a free test.
Okay,
right?
great.
So if there were a case in your facility at any point, since we've been doing testing, you could have gotten a free test. So that's all great. We do have a testing schedule in place now where we have a mobile testing team at every county health department for drive-through testing at least once a week. And that's on our website where you can go. And we do it from like noon to 7 because we know people have to work. And that way we can go a little bit after hours so people can have access to that test after work. But we did actually open it up beyond K-12, where now any employee of a child care center can go online and register to get tested. And you don't have to have symptoms or have to be exposed as a child, as an employee of a child care center. You can just get tested if you want to. We haven't had a whole lot of uptake on that right now, but we've had quite a few. But hopefully we want y'all to know that's an assurance that you have ready access to that when you need it.
And just peace of mind, I suppose, with childcare teachers, assistants, anyone who's interacting with children. Okay. And so earlier you mentioned that there is on your website, you have specific information about this, and that's being updated frequently. What about the reporting of COVID-19 within child care centers back to the State Department of Health? Is that working similar to reporting as in the school system?
Well, we don't have a mandatory, so for the school system, we do have a mandatory sort of reporting framework they need to do, basically just fill out a spreadsheet that talks about number of kids infected, isolated, quarantine, teachers, et cetera, number of outbreaks. We have not done that for child care centers for a whole host of reasons, but really we deal with that in the same mechanism we do with other businesses, other venues where people are going to be exposed, and we do our contact investigations and we work with them individually. But we don't report them out to the public like we do with the K-12. You may not realize, but some weeks ago, well, probably now it's well over a month, we did divert the majority of our investigation resources to kids and young adults 24 and younger, because we wanted to really capture those who might be at risk because of going back to school, going back into childcare, going to college. So we have really pretty much rapid response teams available to look at each case and make sure that we identify folks who might need to be isolated or quarantined, and they can also assist with sort of outbreak response.
Okay. Well, the deployment of your staff across the state has just been tremendous, and we'll talk about that, I know, a little later. But basically, the backbone of prevention, the backbone of getting information, consistent messages out there has certainly come through the Department of Health, and we're so appreciative of that. And as I said earlier, the work between the Department of Health and the Department of Human Services around child care has just been tremendous. And I think beyond COVID and beyond this immediate response, it has facilitated some bridging and some working together for the best interest of the child. So, in sort of signing off, and I wanted to bring Andrea and Chad back on. Are there any questions are there any things that I haven't asked you a question about that you would like to speak on? That would be any of our guests today. So Dr. Dobbs, any closing comments regarding childcare and COVID?
Yeah, just be patient. We know it's tough, but we also know what works. We more so in the school situation than in the childcare situation, we've seen people get a little bit frustrated by the quarantine requirements. But that's really a critical tool to kind of prevent the waves of spread you'll see when you don't have any sort of bulwark against the next set of cases. So, please just be careful, understand that the things that you're doing to prevent COVID are not only protecting the kids who are under your care, but also your own families. So just please keep up the good work.
Well, thank you. That reminds me of a mantra of one of our board members who's a school superintendent on the Mississippi Gulf Coast. And a few weeks ago, we were having chats about children in the midst of COVID, children and youth entering school with Dr. Evers and Dr. Carrie Wright. And one of the closing words from Dr. Evers was quoting her mom, who said, basically, we need always, but particularly in these times, to practice patience and give grace. So when you mentioned that, Dr. Dobbs, about patience, it reminded me of Dr. Evers' quote on that. So thank you all. Thank you for the whole team of people that you represent all across the state. Kudos and thanks to each of you. I think that public service is in a whole different level these days than what it was before, because you're still continuing on the running of the agencies and the protection of health and the protection of children and child care. So thank you very much. Thank you, Chad, and we'll thank Andrea on the behalf of the Children's Foundation, and Dr. Dobbs as well. Thank you.